I would like to talk about lumbar or lower back extension exercises. Normally, our lower back has a curve we call lordosis, which you can see on the skeleton here. It has a little bit curve going this way. And that helps to maintain the spine in somewhat of a straight position where the discs sit in better place. However, in daily life, we tend to sit slouch. When we slouch, the spine is bending forward into what we call flexion. That creates more stress in the front part of the disc, which could cause some loading to the back. Therefore, we should have somewhat of a straight posture. The most common problem with the bad posture and slouching is that it could irritate the disc. And if the discs start to drift backwards, it could cause a bulge or herniation. If that compresses the nerve, then you could have pain down the leg, which we commonly call sciatica. For the lumbar extension, the easiest way is to do it in standing. So in standing, if you take your hand and put the base of your palm on the belt line, and if you bend backward, you could actually feel the pressure there. So you can see when I push, I almost push my belly button forward a bit. If you keep your body steady and lean backwards, you're gonna feel like you're gonna lose your balance and fall down. Okay, so almost like you're pushing your belly button forward to get that extension. We could do it with two hands, like this, going straight back and come back. We'll do 5-second hold, about 10 repetitions. If your one leg has a problem, and make sure you get cleared by your healthcare practitioner. If it's a disc problem, we will use one hand. So let's say if my problem is on my right hip here, I'm gonna use my hand and put it on the right side more. So when I bend backward, automatically, because of my hand, I will go a little bit more towards the right side. So from back here, you can see my view here. If I put it here, when I bend back, my head almost swing more towards the right side. That will help to compress the disc on the right side more and push it back in. So the extension in lying down, the easiest way is to do it on your stomach. I'll show you in a second. Basically, we're going to do a lazy push-up. When I lie flat like this, I want you to keep your arm by your side, okay? I want you to keep your belly button on the table when you push up. We'll do a half push-up over 5-second hold and go on back down, okay? When you get better, if you push really high, you can go to full elbow straight, but make sure your belly button stays there. I don't want to see you lift it off there, okay? So the other thing is when you push up to the top, I want you to breathe out. When you breathe out, just relax your back and almost let your belly button sink down towards the bed. Over 5-second hold, and then go on back down. So that was with two legs. Now we're going to do it one leg. Like I said, if I bend my problem side up like a froggy leg, then when I push up, I will bias the right side compression and going back down. So initially, when it's hard, just go onto your elbow and stay there, okay? And come on back down. When you get better, then you can push it up with your arm. So when you do these low back exercises, make sure the pain does not shoot down towards your leg. We call that peripheralization. You want the pain to go back towards your spine.